You know, in school, we were taught you must use ice when you have acute injuries because there's blood flow, there's swelling, and you want to reduce inflammation. Sounds logical. Everyone knows it's true. You do the RICE protocol, right? Rest, ice, compression, and elevation. But I do know, working in the healthcare profession for 30 years, that there are so many things that were supposedly true, and everyone knows that they're true, end up being completely false. And I could not find any evidence at all that shows that using ice for acute injuries improves your recovery or gets you back to a normal state. Now, it is true that ice does help decrease pain, okay? And it probably reduces inflammation because it creates a vasoconstriction effect. It pushes blood out of an area that is inflamed. But do we want to reduce the inflammation? That's the question. Is this inflammation pathological? Is it a negative thing that we need to get rid of? Well, maybe in a chronic state, but not in an acute state. You see, inflammation is such a fundamental part of healing. We have increase of immune cells, macrophages, to help clean up the area. We have an increase of oxygen, blood that carries nutrients and hormones like insulin growth factor number 1. So you have this incredibly complex, coordinated effect of your body trying to heal an area. And then people start doing things that stop the healing process. And applying ice actually inhibits recovery. It slows down the repair process. It delays normal function. Now, applying cold therapy does decrease pain, but at the expense of inhibiting recovery. And also when people take medications like NSAIDs, those actually slow the repair as well because they get rid of inflammation. And so the key to repair is not to reduce inflammation prematurely. I mean, the same thing goes with a lot of other things in the body. If you have a fever, for example, your body's trying to heat up to kill off the virus. Or if you start sneezing, your body's trying to eliminate something that's in your nasal passages. But I do remember in school that we were taught, okay, that you definitely use this RICE protocol on all acute injuries. And then if something is chronic, you use heat. Now, do you use heat on an acute injury? Probably not, because that's going to actually add more swelling and inflammation and pain. Now, another question is this: does rest improve your recovery? And the answer is no, it does not. It actually slows your recovery because your lymphatic system doesn't have a pump and it requires motion to push things out of it. And so the more you rest, the less recovery you're going to get. In the lymphatic system, we have a lot of waste going on after an acute injury. So the question is, what do you do for acute injuries? Well, you put motion as much as you can into that joint, okay, or that area of your body. Now, of course, if it's fractured, you don't want to put motion into the area, but if it's strained or sprained, you want to put a passive range of motion or sometimes active range of motion, depending on the severity. More motion will activate more lymph and more circulation, and it'll speed up your recovery. All right, number 2, a really good therapy is infrared therapy. This is just putting a light into a certain body area. And this has been proven to increase the recovery of an injury and dramatically decrease pain as well. Now, I want to skip to number 4, okay, vitamin D. Vitamin D is a natural thing that can greatly support your immune system. And if you have any inflammation at all or pain, I would recommend a higher dosage of vitamin D, like 40,000 IUs, probably every day for maybe a whole week. And you will find out very quickly that you'll shorten the recovery time. Now, this is what I want to talk about right now. Manual therapy, opposite side. Now, what does that mean? Manual therapy, opposite side. This is a very interesting technique. It's counterintuitive. I used it in the practice for many years. I trained doctors to use it. So basically, if you injure your right ankle, for example, you would use manual therapy on your left ankle. You always work on the opposite side. Now, at first, it sounds kind of weird, and you're like, well, that's not going to do anything. But go ahead and try it. You will find it will work. All the nerves on the right side of the body are connected to the left side of the body through the spinal column. And when you work on the left side of the body, it affects the right side of the body because it's on the same circuit. And these neurological circuits are embedded in your muscles to allow things to be coordinated so you can walk and you can perform certain motions. And so even on the right side of your body where you have the bicep, right? The bicep contracts. In order for this to contract, the opposite muscle needs to be inhibited, right? So if there's an acute injury on this side, you would manually work on the opposite side. And what I mean by manual therapy, it could be anything from a trigger point therapy to massage or any type of stimulation. But the next time you injure yourself, you need to try this out to see for yourself. Because even if you were using a hammer, right, and you hit your thumb on the left side, and you started to massage the right thumb, you would notice a dramatic decrease in pain, okay? So just remember, anytime you hurt on one side of the body, stimulate the exact opposite mirror image side. Now, it also works in another way, okay? So if your back is hurting, okay, you can also work on the front part of the abdominal area right here. Now, the next most important video for you to watch, since we're talking about pain, is on referral pain, okay? This is a very important video. If you haven't seen it, I put it up right here. Check it out.